Hello, everyone. My name is John McKay, and I'm the Member of Parliament for Scarborough-Guildwood, and my guest today is Jeanie Argiropoulos. I've known Jeanie way too many years. Jeanie, you're famous in Scarborough for the work that you do with the Scarborough Community Healthy Networks. But before I get to that, I wanted to find out a bit about you. So where were you born?
Well, thanks for the interest and the kind words, John. So I was born in Toronto, born and raised from Greek immigrant parents. So first generation Greek, and we lived in East York for about 7 years. And I've been lived in Scarborough and grew up and went to school in Scarborough subsequent to that.
Well, there you are. You know, there are two kinds of people in this world: people who are born in Scarborough and people who are not. And of course, the people who are not are quite jealous. But I'm glad to see that you had the insight to move to Scarborough and live here. So tell me a bit about your parents. How did they come to Canada?
Yeah, so I think it's a traditional newcomer story. My mother was sent here first by her family. She had her siblings that were here, and her parents wanted to give her more opportunities, and so they sent her to follow her brother and sister, and she came to Canada. And a couple years later, my father came for similar sort of reasons, looking for a better opportunity, and they met, and the rest is history. Got married shortly thereafter, and had two kids, and wanted to kind of move into a community like Scarborough where they could safely, happily, inclusively kind of raise their family at that time. So my mom's
yeah. So did they move into one of those classic Scarborough bungalows, and you walk down the street and you say to yourself, how do these people keep this place looking so neat? The flowers are so rich. The vegetable garden is in the back, is full of that. Is that that kind of family you were raised in?
100%, John. We're not far away from our mid-Scarborough hub location at Burnley and Eglinton. My mother's roses were esteemed at the front, and my dad's vegetable garden rivaled the farmers in the area. So that was 100%. The lawn was always perfect. Yeah, it was it.
Yeah, I walk past those places and I'm intensely jealous. I know how in heaven's name these people do this stuff, because my lawn is always full of weeds. My garden, well, it's kind of a hit and miss, and I'm, as I say, I'm intensely jealous, particularly of the vegetables. And my father was a market gardener, so I am the family embarrassment, given the state of our garden. So you were raised in Scarborough. Where did you go to school?
I went to Nob Hill Public School, and then later on to what was John McCrae Middle School, and Thompson. I'm a graduate of David and Mary Thompson when it was at Brimley and Lawrence there in between Midlands. So
Thompson's a famous name in Scarborough.
Yes.
Some of the original settlers are Thompson, and in fact, Thompson Park was donated by the Thompson family to Scarborough, and it's really a treasure and a gem in the middle of Scarborough.
Yes. Yes.
So where'd you go after Thompson Collegiate? And of course, Laurier beat you in basketball every year, I have to say. Yeah.
My brother was on the team. He might take offense to that, but you're right. So after that, I went to University of Toronto. I was at the downtown campus and pursued sort of just a very general degree in psychology and sociology with a little bit of political science in there for variety, and then ended up falling into healthcare a little bit by accident, a little bit on purpose, I guess.
Yeah. So you went to the downtown campus because you couldn't get into UTSC. Was that the issue?
I was maybe a little bit of a rebel, wanted to get a little bit further away from my parents for a few hours of the day, coming from a traditional Greek family.
The only reason I went to Queen's for law was that I didn't want to live at home anymore. I understand it. I understand completely.
Yeah.
Fun fact, you're interested to know that UTSC has had the top undergraduate scholar in the entire U of T system in the last 7 out of the last 10 years. So
Not
look at
surprised.
you missed going to the elite institution of Scarborough or of the University of Toronto. So anyway, fun fact, there we are. So you graduate, you fall into healthcare, and your first job is with the Scarborough Hospital. Is that correct?
That is correct. Back in the day when it was Scarborough General Hospital, and I stayed through the merger to the Grace. I worked there for 21 years before I left the hospital and came into the community. So of a long history of healthcare, but I really wanted to stay working and supporting the Scarborough community.
So when you transitioned over to Scarborough Healthy Communities, was that when it was at Galloway Road, or did it?
No, a little bit later, but we were at Eglinton and Kingston, or Eglinton and Markham Road. So
Right.
they'd grown a little bit at that point, and it started to expand on a few of the sites that they had. But that was back, yeah, in 2009-10 when I came out to work at what was then called West Hill Community Services. So.
Right, right. That's I'm glad you refreshed me on that, because that's how I originally knew it, as West Hill Community Services, of course, because of Bob Lobson, my
A friend of
good
ours,
buddy.
yes.
Yes, yes, mutual friend of ours, and great mentor, and sadly missed. So where's your location now?
So our main office, which I'm not a huge fan of that terminology, is at Markham and Lawrence. However, we've got 11 sites throughout Scarborough and really do reach across the geography there, including Burnley and Eglinton. We have a new location that we've opened up at Ellesmere and Birchmount area. We've got programs within housing along Lawrence there. A lot of folks know us for the food bank that's at 4100 Lawrence Avenue, which is great that we're there. Unfortunate that there's such a need, and we're well known for the work that we're doing out of those locations. So those are a handful of the sites that we're currently.
I'm going to assume that
demonstrating out of.
most people listening to us chatting here would don't really know what Scarborough Center for Healthy Communities is or does. So in the cheap elevator pitch, what is it?
What don't we do is what I like to say. I used to say we're Scarborough's best kept secret. I think that's changing a little bit now, but we do everything from social and community supports, primary care, end of life services like our hospice palliative care bereavement program. We provide diabetes education. We have early on and a lot of youth programming. So prenatal, like, end of life, right down to end of life. So we dabble in a lot. Really proud of the work that we do in terms of social support and social services. So things like our food bank, clothing, furniture banks. We do housing prevention. We also have assisted living and PSWs who help support our residents, in particular seniors, live independently in their home for longer periods of time, for as long as they can. We have adult day programming for seniors as well, Meals on Wheels, transportation services. So we really are involved in a lot of work, and more so as well, supporting mental health and addiction programming as well for Scarborough residents.
Well, that for an elevator pitch, we need a lot of floors on the building. We're going up or down. My goodness, those are a lot of services. And how do you fit into the Scarborough Health Network?
So we're a good partner, strong partner with the Scarborough Health Network. We're also a member and a partner of the Scarborough Ontario Health Team, but we have a lot of shared programming that we do together. So, I mentioned a number of them with regards to hospice palliative care, supports in terms of even access to primary care, diabetes education, a lot of programming, and most recently have definitely expanded that partnership work in the response to the pandemic. And so the vaccination clinic that we host is in partnership as well with Scarborough Health Network. So some examples, it would be a very long list as well, but we work very closely together to make sure that folks, first of all, don't have to access hospital services, but when they do and they're ready to come back out, that they have the appropriate supports to do so.
I want to get into the element of the response to the pandemic, but I wanted to first of all get into the element of how your operation was affected, March of last year when it became, a real lockdown and I assume affected your operation, your services quite dramatically. So could you describe that to me?
Yeah, it was really pivotal. So I have to say, I'm so impressed and proud by the staff who really started to innovate in terms of ways to connect, because like so many others, we weren't able to do a lot of what we normally would do in person because of the restrictions that were imposed for the health and wellness of the community. And however, we couldn't just close our doors, so to speak, and say we're not going to offer these services. We needed to find ways to still stay connected. Things like the food bank, typically you have hundreds of people going through that food bank on a daily basis. And so finding safe ways to still be able to provide those services, to provide more delivery models, sort of taking the food to people. We did a lot virtually, and so the paradigm too, even with our seniors, that they can't use technology and virtual programming won't work, was definitely challenged. And we were really impressed not only by what our staff were able to come up with, but the uptake from a lot of our community, and in particular the seniors who do some of that programming, because we do so much work in supporting our seniors to stay active. And so did things like interactive bingo online, yoga classes online, health promotion education classes online, and then also made sure that we were able to provide those services that still required people to be in person, that they were maintained, and we had the appropriate supplies and PPE to make sure that that was done safely. As Meals on Wheels continued, like we needed to continue almost every service that we had, and in some ways we had to reinvent and do it differently. We were challenged because our organization is blessed with the support of so many volunteers. It really does require volunteers to have to support
So
programs.
how many volunteers would you have at any given time?
Typically at 600 volunteers a year.
600 volunteers?
600 volunteers.
Oh, wow.
And the hardest part for us was to be able to have to say to the volunteers that they couldn't come in and support the work. That was really challenging for us and for a lot of the volunteers who really depended on the support and interaction that they were having with the community. So last year, we still managed to work with 130 volunteers, but COVID definitely really impacted that.
And how many staff are you running in at the time?
We're at now about 250 staff that support the organization.
250 staff, 600 volunteers. That's getting to be a serious operation. It's a very serious operation. And how many people would you service over the course of a year?
Over 14,000 was sort of last year what we would service. So,
and is that a typical year?
It steadily grows year over year, partly because our services grow, but also as we're seeing needs and shift and grow in Scarborough as well.
Yeah. Wow. So I did want to talk to you about the Scarborough Health Network and your interaction with Scarborough Health Network, and you and I sit in on some Zoom calls from time to time with Liz Buller. I want to call her Ann Buller. Liz Buller. How do you have two female CEOs with the same last name? Escapes me altogether, but it is what it is. So Liz Buller at Scarborough Health Network. And the first part of the story was not a very pleasant part of the story, because a lot of Scarborough residents were getting COVID. A lot of Scarborough residents were dying. They were dying in situations that superficially to somebody from the outside like myself appeared to be preventable deaths and preventable sicknesses. And I thought that the community health services writ large really started to pick up their game. But from your perspective, what was your reaction over the last 14 months on how the Scarborough Health Network has worked?
Oh, I have to say, I'll declare my bias because I worked there for so many years and still interact with some folks from when I worked there. But I key to how well Scarborough has responded has been the Scarborough Health Network, because we've come together and they very openly and honestly, authentically reached out and embraced what community organizations had to offer and the experience that we could bring. So obviously the hospital has a lot more resources than many of our organizations do, but we bring a lot of experience and knowledge of the local community. And so being able to come together, being invited and included from the get-go on the tables and decision-making tables that would help influence how we responded to COVID in Scarborough was really very critical. So, I'd get the calls from Liz on a Friday, Saturday saying, can you join on and participate in this table, that table, this meeting? And we really need the input and experiences that SCHC and you can bring. And that was very, very welcomed and not always typical of what a hospital community relationship is. Often, the hospitals tend to have the resource and expertise and may not always respect the experience that their community partners can bring. And I think because of SHN's openness to be able to do that and include myself and many others around the table, and we'd already started working as an OHT, an Ontario Health Team, even though we weren't officially approved at that time, we're able to leverage those relationships and that experience to really, I think, come together and help, mitigate the terrible impact that we were seeing and are still seeing in Scarborough.
Right. Yeah, I that was my observation as well, that the day-to-day on the ground stuff was David Betteris, but the overall strategic direction was Liz Buller, and along with Dr. Lawrence, and my observation, albeit imperfect and from afar, was that Scarborough Health Network did pick up its game. That they weren't just paying lip service to the community partners. That you have to listen to them, and then they can teeter out of here and go off and do whatever it is they do. I think that to my mind was to the benefit of the people of Scarborough, was my sense of it. Is that a correct observation?
100%, John. I'd echo everything you said. It really, really was. It is what helped make a difference in terms of what could have been a terrible situation, even much more worse.
Right. And it came down to things like vaccine distribution. Scarborough Health Network was kind of getting the same per capita share as very affluent communities or very affluent health networks. Their rate of infection was quite dramatically lower than Scarborough's, and yet they were getting the same number of vaccines, and that seemed to be lunacy to me. Why would you take well, as I said to the Prime Minister, why would you take a fire hose to where the fire is not? So I like to think actually that the politicians made positive contributions at all levels as well there. I can only speak for the federal ones, but the Scarborough caucus was unanimous in its view that as vaccines became available, there need to be a more equitable distribution. By equitable, we meant go where the virus is. Right. Don't hand out the doses to where the virus is not. And so I thought that the second wave and the third wave were handled much better. So anyway, it's kind of a nice example of people learning lessons on the fly and working forward. So we're getting close to the end here. I'm always amazed that people involve themselves in community endeavors and literally spend a lifetime doing what it is they do. So why do you do what you do?
Oh, it's a hard question and an easy question. I mean, the simple answer is I absolutely love what I do, and working at Scarborough Center for Other Communities, the impact that we have that you could see it's so immediate in terms of the response is the most rewarding piece. Having grown up and worked in Scarborough my whole life, being able to really give back and contribute and hope that I help make a small difference in the lives of so many folks, and leading the team that I do, and really advocating to bring more and more resources to Scarborough. And I think you know and appreciate, John, how we have not had our fair share of resources over the years, and COVID really highlighted the inequity that was there, as you mentioned, everything from the vaccine rollout to how we provide other services. So I really do what I do because of the people of Scarborough, and seeing the community that comes together, regardless, big or small, to really advocate, support, the gratitude, the appreciation, but also the leadership. Our folks in Scarborough don't just sit back and wait for things to be handed to them. People in Scarborough are actively involved. We have so many community ambassadors right now that are really, out there promoting the health and wellness of their neighbors, supporting each other as they come together. As I mentioned, 600 volunteers support the work that we do on a regular basis. I don't know of a lot of communities where that might be the case. I think Scarborough takes the cake in that, and that's part of what really motivates me day in, day out to come in and do what I do.
Yeah, that is a very encouraging thing to. Yeah, and in fact, you have 600 validations for the work that you do, and of course, those 600 validations are multiplied by the families that they represent. Yeah, it is good to see people doing those things. I see that you picked up $100,000 grant, so your advocacy must be really working. What was that for?
Is that the accessibility grant that you're referring to?
That's right. That's right. Yeah.
Yes. Yeah. Again, just to improve on some of the states of our buildings and locations. Some of them are a little bit older and really need, again, given that we deal with a lot of seniors, enhancements to make them easier to access and safer for our community. So we're really honored to be able to get those dollars to be able to support those changes that we don't get funded for otherwise, right? We either need grants or donations to do that work. Mm-hmm. And it's really great to see that recognition come in so we can help people.
Well, I know $100,000 is not huge, but it is a bit of a tangible representation of the appreciation that you are held in. But I dare say that while you do what you do, you have 600,000 validations, and behind all those 600 validations is actual real people with real needs that you are really helping, and you are making our community so much better. So thank you, Jeanie. It's very kind of you to come on, and we do appreciate it, and we don't say it enough. So thanks.
Well, thank you for the opportunity to come and chat, and also for the ongoing support. Really appreciate. You've been a strong leader in Scarborough, as we say, for many, many years, maybe more years than either one of us wants to remember, but well worth it, right? So thanks so much.
Many centuries, yes. Yeah. All right, thanks again, Jeanie.
Thank you. Take care.